All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I'm the prenatal and pediatric chiropractor here at the Cap Wellness Center. And this podcast is all about helping you have a proactively healthy pregnancy so you can have a safe, gentle, natural birth. And that's going to allow you to bring your baby into the world that much more gently and healthily so you can start off your family experience more powerfully than if it's full of stress and trauma and other health concerns. So if you are a fan of this show and you haven't yet subscribed, please do so. Wherever you listen to your podcast, go ahead and subscribe so you don't miss an upcoming episode. And also, if you haven't rated or reviewed the podcast and you've enjoyed it and gotten value of it, that will really help me out because that'll allow this podcast to reach more and more parents like yourself that might be missing out on this type of information and helping them along their parenting journey. So thank you in advance for that. And thank you if you already have rated and reviewed. And on today's episode, I have Dr. Dawn Andalon here. She is a women's health PT. She's a physical therapist here in the San Diego area, and she's actually one of the newer members of the Cap Wellness team here. She's been teaching a workshop series for our postpartum women here called Restore Your Core and Pelvic Floor, and it's been going really, really well. And today we're going to have a specific discussion about pelvic floor and core restore for C-section. There's a lot of questions that women have after having a C-section, whether it was planned or unplanned, especially if it's unplanned, about, how much you should be doing, how little you should be doing, when do I start, when's too late, when's too soon, and how do I get even started? So she's going to answer all of those questions and more today. It's going to be a great episode. But before I switch over to that, let me take a word from our sponsor, and then we'll jump right into our discussion. Hi, it's Dr. J, and I am so excited to announce to you that my new online program is now available. It's called Connecting with Baby During Pregnancy, and what it's going to do is going to teach you methods proven by the latest research in pre- and perinatal psychology and epigenetics that are going to allow you to have not only a calmer and more relaxed pregnancy and to have a gentler, more natural birth, but on the other side of things, you're going to feel more confident as a mom, and you're going to be able to soothe your baby that much easier, because when you're able to bond with baby and connect right now during your pregnancy, it's only going to translate on the other side to just being that much more connected and be able to help them calm and soothe. It's a really important thing. So head on over to drj.warren.com/CWB, that's Connecting with Baby, and you can learn all about it. All right, let me introduce Dr. Dawn to you, and we'll be able to switch over to my conversation with her. Dr. Dawn Andalon is a physical therapist, educator, author, and co-founder of Level4 Physio-Wellness-Performance. She's known as a leading spine and women's health specialist in the San Diego area. Prior to living in Southern California, she worked at Nike headquarters in Portland, Oregon as a physical therapist and consultant. After having 2 kids, she saw a need for more highly skilled programs for women who are struggling with common body struggles after having a baby, so she went on to seek more training in pelvic floor rehab and the female athlete through the Herman and Wallace Institute. With her background in peak athletic performance, combined with her passion to educate pregnant women and postpartum women, she's now reaching a larger audience with her postnatal rehab coaching series, helping to bridge the gap from labor delivery back to an active lifestyle. Dawn lives in Carlsbad with her husband, Oscar, who's also her business partner and a physical therapist as well, and her 2 young daughters. So with that, let me switch over to my conversation with Dr. Dawn. All right, Dr. Dawn, welcome to the podcast.
Thank you. So excited to be here.
Yeah, I'm glad to have you on the podcast because I've been loving working with you here at the Cap Wellness Center. You've been offering some classes around pelvic floor restoration, core restoration, and we'll talk a little bit about that. But I'm really glad that you agreed to come on today to talk about specifically C-section recovery, because I get a lot of questions about that. And so I'm happy to have you. And, as we read in your, or as the listeners heard in your bio, you're a physical therapist. You have a doctorate in physical therapy, but you're also have specific training in women's health PT. Tell our listeners more about that.
Yeah, so I actually started my career as a physical therapist, more as an orthopedic manual therapist. And my first job out of school was actually with a women's health specialist. And that's when I got really interested in how the specialty could really help a lot of people out there, especially women that didn't know where to turn to. They were having these issues that maybe their doctor didn't know how to address, or they weren't sure who to see for it. And sometimes these women would come in, and after 2 or 3 visits, it was like things that they had suffered with for years or too embarrassed to talk about, that they were being treated, and they would feel a whole lot better and just have a better quality of life.
What were the kind of things that those women were coming in to see you for?
Yeah, well, things like chronic pelvic pain, so pain with intercourse, also bladder incontinence issues, embarrassing things that they don't necessarily want to ask anyone, or they think they have to live with it. And so these things were being addressed by the other physical therapists that I was working with. And so I started looking into training to become more of a pelvic floor physical therapist. And definitely after I had my own 2 children, who are now 6 and 8, I got all these questions from other moms, knowing I was a physical therapist, but I wanted to learn even more and really become more of a specialist in that avenue, because I found there's such a need, and there's a lot of questions that women have that they're going online to look for answers, and they really need that guidance.
Right. And that's, a lot of listeners from the podcast are saying the same thing of, silently or anonymously, they can listen for information or search online for it, but then they want to take those next steps of, okay, this is definitely a problem I'm having. I didn't realize it could be treated or it could be helped. Now what can I do? And so that one is great, but then also we want to, and what we'll be talking about today is, if you're finding yourself in the throes of things, what you can do today to be helping. Specifically, we'll be talking about C-section. And a lot of our listeners of the Healthy Births, Happy Babies podcast, they're wanting to go more natural vaginal birth. And as life throws it, that doesn't always happen. And there's no judgment or shame around that. And it's not necessarily that anything's bad around it. It's just that wasn't plan A, and they might find themselves in this plan B. So they might not have done any prep work to say, okay, this is how I'm going to recover from my C-section, but they find themselves there now. So when a woman comes to you, or even before they come to you, what are the most common challenges you've found having worked with women with C-section postpartum that in those first days you would advise them about?
Yeah, I think number one, and this is everyone's guilty of this at some point, especially because I work a lot with the active female, and people want to jump right back into things quickly without realizing that your body really does need that healing time. And some people's expectations aren't always what they should be. And so that's where it's my job to guide them in the right direction and really assess if it's a realistic goal that they have, whether that's going back to a marathon, going back to high intensity workout class, anything like that. So I would say that's the number one thing I hear. Okay. So I guide people in the right direction.
And that starts jumping back into quickly. That starts just in the first couple of days of like how you're moving around and driving cars and picking up babies, all those kind of things. So a lot of women are told like you're not supposed to drive for a certain amount of time. What's the typical recommendation around not just driving, but moving around, say in those first couple of days to weeks? Should they be moving more than they are?
So definitely the women that I've seen have done too much, more commonly than not enough. And it's very eye-opening to them after having the surgery and coming home and having to take care of a baby, that they realize they need help at home. Every little movement that they do, they're going to either feel some discomfort right off the bat. And some women say they didn't quite expect it to be as bad as it really was, but other women say that they really had to slow it down, take it easy, and have help at home. So some of the things to watch out for are, you're doing too much if your incision opens, obviously,
Yes.
or you start having some bleeding, or you really have to listen to your body.
Yeah, and it's one of those things with as major a surgery as the cesarean is, it's not like you get to go home after that surgery and just rest for a couple of weeks and not do anything. You're taking care of a kiddo, and that's
Exactly.
super exciting and challenging regardless of how the birth went, but especially with that kind of major abdominal surgery, it's really a call for getting help and to do just like the majors for the kiddo and to help yourself and to put everything kind of back burnered so that you can lay a foundation for months down the line for everything to be exactly how you want it.
Yeah, exactly. I don't know the true recommendations. Every woman's going to be different, and they usually say 6 weeks. That's where your recovery time has, they kind of draw the line there, but everyone's different. And I've had women at 6 weeks, they were ready to start doing a lot more. And some women at 6 weeks feel like, they're nowhere near, getting out there and taking the baby out and walking around.
Right. And it's one of those things where the 6 weeks is the classic time, right? Like you have your baby. If you've had a C-section, typically your OB is doing a check a few days to a week afterwards, but then you come back in for your 6 weeks post-check, assuming everything's okay. And there's, in my experience, having talked with a lot of women, that examination is just like, is everything all right? And they say yes. And then you're saying, okay, you're cleared to exercise. But that can be far from the truth. So I'm sure you advocate this, but I will say it to our listeners also, is that it's really important to have a professional in women's health, either a physical therapist or a pelvic floor specialist like yourself, to get examined and really to know and have it out of the back of your mind of like, maybe it's too soon, maybe it's not, but then really be able to launch in. And that's really what you're doing with the class that you have here, the postpartum and the pelvic floor restore. Are there things at home that a woman could do, or just even to feel in their bodies in that, like, say, 4 to 6 week range that would say, hey, this is a red flag, I should get it checked out, or that things are, not right to get back to moving exercise wise?
Yeah, I actually do have a link on our YouTube channel, Level4 Physio, that we have a self-assessment for diastasis recti.
Oh, great.
Yeah, so that takes you through a video of how to do a basic self-assessment if you don't see somebody that can assess you. And then also, in regards to a C-section, start moving that scar around and doing the scar tissue mobility. And a lot of women don't, even want to mess with it or touch it. But once it really has gone through that healing phase, it's very important to be able to lift it up, move it around, and do some self-massage of the area, because that's one big thing I'll address right away. And a lot of women can get adhesions, and it definitely affects your muscle control and how you're able to contract your core muscles and your pelvic floor, and it affects back pain too.
Right.
If things are really locked down and adhese.
Do you find, all women that I've worked with postpartum have that period of time where they're just, I know I'm supposed to activate my core, but like I can't find it. They're just not able to access it. Is it worse with a C-section, that sensation of not being able to move in a physiological sense, or is it more in a kind of mental awareness sense of, okay, that area was cut, I don't want to move it? Have you had that experience?
Yeah, both aspects to it. And I do think it depends too on the C-section. If a woman was going in and actually laboring and pushing, so there was some pelvic floor either trauma there, or they were prepared for a vaginal delivery, but then they ended up having a C-section sometimes too. That can be two areas that will affect how much they're able to actually contract their core and be able to, and we're talking about the core, the deeper abdominal layer, the pelvic floor, how that all works together as a system. And it is very common. I hear that a lot. Like, I just feel like jello. I can't contract my muscles. What do I do?
Right.
So it is starting and addressing that scar tissue first and seeing if that's affecting the ability to actually contract their muscles. And just getting everything in balance first, and their range of motion and their posture, and then addressing strength.
Okay. So in that, like, massaging, it's going to loosen up some adhesions so that there's more, one, mobility allows for more contractibility of those muscles. And then what do you have a person kind of start with? You said you like going to posture first before strengthening?
Yeah, well, I would do a full body movement assessment. So that way I can see how the spine is moving, how the hips are moving. And most women will have pretty good mobility, especially with the relaxin and the hormones that are still in the body system. But we want to make sure, going from a certain posture when you're pregnant and having the baby weight out front, and then not having that anymore, it's going to throw off your posture. And so addressing that, but also looking at the ability to do some deep breathing exercises and work on relaxation before the actual contraction. Because a lot of times too, with trauma, you're in this constant state of contraction and you don't even realize it subconsciously. So the breathing exercises really get down into the pelvic floor, the abdominals, the belly breathing. And that's what I would start with after addressing any scar tissue. And then from there, working on posture and then addressing strength deficits or movement deficits that they have.
Right. And is there, with that, you made a good distinction of a cesarean that's happened after, trying to labor naturally with pushing. And if something's off with baby position or pelvic alignment, that can cause, things to not progress in that way. So cesarean, which is going to be very different than just a planned cesarean. And with that, say after a woman's done all of these things, they've done the massage, they're looking at full body movement assessment, they're addressing posture and doing the deep breathing. Is there gonna be a longer base, or a wider base that you're needing to build with a postpartum cesarean patient that you're working with, rather than a regular vaginal birth patient? Or is it pretty much the same once the cesarean sutures has been healed?
Yeah, so I definitely ask about any urinary incontinence issues. Are they having leakage when they cough, sneeze, or when they have a very full bladder? Do they obviously lose control? Those kind of things. I ask the question, are you having intercourse yet? Is it painful? And some of the pelvic floor symptoms may have been there before, but just not very prominent. Some actually get better afterward. Some get worse afterward. So it really depends on the person. But I would say generally, you may not see as many pelvic floor issues if it was straight cesarean without pushing. I recently saw two different women that both had a vaginal delivery, they thought, and then it turned into a C-section, whereas they had more actually hypertonicity of their pelvic floor muscles, and they were both having issues with constipation because their pelvic floor muscles were under that after trauma type state, and they were having trouble relaxing.
Yeah.
But a general C-section, if it's planned, you might not always see that. It just depends on the person.
Okay. Makes sense. Well, in our closing minutes here, where can people get more information? I wrote down you have your YouTube channel with the self-assessment for diastasis. I'll get that link and make sure it's there. But where can they learn more information about everything you've put together?
Sure. It's level4pt.com, and you're clicking on women's health. And that way I have a video explaining some of the things that I would normally see. And also we have free reports on our website with postnatal back pain, tips to help pelvic pain, and general women's health questions that we get a lot, and things that you can learn right away, what you can start doing.
Great. And for those listeners that are here in San Diego, in the North County area, like you're teaching classes all over town. Like we're really fortunate to have you here at the CAP Wellness Center teaching the pelvic floor core restore, as well as other things around town. So I'm sure those events are on your site as well. Well, what's the major take-home point that you'd like a woman listening to this to leave from our conversation?
Yeah, well, I can't say enough just to be your own advocate for if something doesn't quite feel right, or you want to be more active, but you're having trouble doing so because certain issues are coming up. All you have to do is go see someone that's a women's health physical therapist. And in all 50 states, we have direct access. So you can actually pick up the phone. With me, I do a free telephone consultation or even a 20-minute discovery visit in person. So that way you can not have these embarrassing things going on where you don't know who to ask, and I'll be happy to guide you in the right direction.
Fantastic. Well, and what about for a little baby that either, hopefully mom's listening to this while baby's still in utero and getting information just in case if that's the case, of the way their birth goes, or if, baby's listening on mama's chest right now as she's here in the world, what little word of wisdom would you like to whisper to the little kiddo?
Yeah, I think, one of the most important things, and I'm doing this right now, is I'm actually, doing a career that I absolutely love. And so following your dreams and setting goals for yourself, I think I just can't say that enough, because I've been in this career for about 14 years, but I'm really working with the population that I enjoy the most, and just follow your dreams.
It makes a huge difference, doesn't it? Yes.
Yeah.
Well, Dr. Dawn, thank you so much for being here today. I appreciate you sharing all of this. My listeners, please go to the level4pt.com. I'll have all those links there so you can just click on it in the show notes. But get informed, get the resources, reach out, and get the help that you need. So, Dr. Dawn, thanks again.
Thank you.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the CAP Wellness Center look forward to helping you and your family be as happy and healthy as you can be.